Account system available.
A very good evening and a warm welcome to all the doctors present here in this session. I am Devolina from Clarnet, and we are very much privileged to have today all of you with us. And Clarnet is very proud to be a part of this session as a digital partner. With all your permission, I would like to play a short video of Clarnet. As you all know, Clarnet is India's largest live digital CME and a doctors-generated medical content platform, which is exclusively free for all the medical practitioners. So now I am sharing a short glimpse of Clarnet. Thank you so much, all the doctors, for your patience. Our website is www.clarnet.com, and I would request everyone kindly do visit our website to get updates on the different topics and different specialties. So now, without further ado, I would like to hand over the session to Dr. A.M. Charan to start with our today's session. Over to you, sir.
Thank you, ma'am. So, a very good evening to one and all present here. I am Charan, a pre-final year student, Joint Secretary, IMA MSN. I'm glad to see the doctors from lengths and breadths of the world having joined in today's webinar. In the past year, IMA Junior Doctors Network has organized a series of webinars for the benefits of our junior doctors. In recent times, we have collaborated with MOHFW, AIIMS Delhi, IAPSM, CHO, and the Star Health Insurance, Max Group of Hospitals, and many national and international faculties. We got an excellent feedback that our webinars are helpful for our young doctors, and hence we are continuing such webinar series. As an MBBS student and junior doctors, we always wonder about the MD opportunities as a doctor. Though we are interested in exploring more and various courses, many of us do not have a proper guidance, and so is our IMA JDN helping us in this difficulty. The Indian Medical Association Junior Doctors Network is organizing this webinar on scope of transfusion medicine as a branch on India, as transfusion medicine as a branch in India, to open up a new view in this field. I'd like to thank Dr. Shajanan Prasad Singh, sir, the National President of IMA, Dr. Jayesh Lele, sir, National General Secretary of IMA, Dr. Anil Goyal, sir, Honorary Finance Secretary, and Dr. Abul Hassan, sir, National Chairman of IMA Junior Doctors Network, Dr. Parul Bam, and Dr. Shiv Joshi, sir, the National President of IMA JDN, and our Secretary, Dr. Karan Janeja, sir. Without whose guidance and support, these webinar series would not have been possible. I'd like to specifically thank Dr. Abul Hassan, sir, for his constant guidance and support. Sir is a senior pediatric surgeon from Erode, Tamil Nadu, and he is the national chairman of IMA Junior Doctors Network. He's also further the founder of MAM Foundation and has served 1,150 plus terminally ill cancer patients. He always stands up for the issues of junior doctors and medical students network and continues his service across different horizons. I am glad to share that Sir is been elected as a state president of the IMA Tamil Nadu this year, and I request Dr. Abul Hassan, sir, to give the welcome address with this concise intro.
Thank you, Charan. And my dear faculties and members of IMA JDN, Dr. Venkatesh Karthikeyan, Rishi, Sinha, and all the delegates who have joined this webinar. First of all, I wish Charan for his maiden venture in organizing this webinar, and wish him to do many more such webinars in the future also. I'm very happy that IMA JDN is finding new topics, which are not touched by the people so far. Particularly this transfusion medicine is gaining so much of momentum nowadays, so much of importance nowadays, and because of because the latest developments in transfusion, the cell separations, the plasma transfusion, and fresh frozen plasma, and all these things have become order of the day, and they are used extensively in treating diseases. One more thing I would like to share with you that transfusion medicine is going to be in the limelight, because government of India is also envisaging an act that is called Patient Safety Bill, that has been under consideration for quite some time, where blood safety and transfusion safety is one of the important things, and they are going to frame guidelines for transfusion, blood transfusion and blood products transfusion. So that is in the pipeline. So that is because this is so important that, there are so many avenues where we can reduce errors in transfusing blood and blood products. And I think I believe this webinar will throw more more lights on all these possible errors that could happen in blood transfusion, and also may ways and means of preventing it. I once again thank Charan and team for organizing this wonderful topic seminar, and I wish all the delegates a good time. Thank you. Over to you, Charan.
Thank you, sir. Thanks for those words and for being always with us. Now, I'd like to call Dr. Venkatesh, sir, for a short intro on today's session.
Good evening, everyone. Thank you, Charan, for the introduction. And thanks to Dr. Abulasan, sir, for always being a source of our inspiration and our constant support. On behalf of IMA Junior Doctors Network, it gives us immense pleasure to welcome all the 1,500 plus registered participants to this webinar, which is about the scope of transfusion medicine as a career opportunity in India. As we know, transfusion medicine is a rapidly evolving field with enormous potential for growth and development, as rightly pointed out by Abulasan, sir. The demand for skilled transfusion medicine specialists is increasing, and there are ample opportunities for young doctors to make a meaningful contribution in this field. In this webinar, our speaker, Dr. Rishi sir, will share his insights and experiences, highlighting the challenges, opportunities, and growth prospects in this field. As young doctors, we are the future of healthcare, and it is essential to explore different career paths and make informed decisions. I urge you, all the participants, to participate in this webinar actively, ask many questions to the speaker, and engage in discussions, enabling you to better understand transfusion medicine as a career. I hope that this webinar will help you make an informed decision about pursuing a career in transfusion medicine and contribute to the growth of this field in our country. Once again, I welcome you all, and I look forward for a great session. Thank you.
Thank you, sir. With that, with full enthusiasm, I would now like to present before you our today's speaker, Dr. Rishi Sinha, sir, MD Transfusion Medicine from AIIMS. So has done his MD, MBBS, MD Transfusion Medicine. He has been an export secretary in the Resident Doctor Association, All India Institute of Medical Sciences, Bhopal. He is also the national executive member of FIMA, and he has received several awards. He's the recipient of the national awards, namely the Student of the Year Award of MBBS Batch 2013, Dr. Abdul Kalam Memorial Medical Excellence Award, and Rashtriya Pratiksha Pushkar Award 2022 by the Worthy Wellness Foundation, Lucknow. He has few publications, published 9 research papers in national and international journals, including 1 ICMR STRG project, New Delhi, and 1 MUHS STRG project. And he's a member of the editorial member of the Editorial Journal of Pharmaceuticals and Medical Research, a national member of Indian Society of Blood Transfusion and Immunohematology, and he's a reviewer in the International Journal of Medical Laboratory Research. With that short intro, I'd now request Dr. Rishi Sinha, sir's permission to start with today's session.
Yes, please start. Please start.
Yeah. So on the topic today, why is this subject is to be taken? Why do you think this subject should be taken?
I am very thankful to IMA JDN for just giving me an opportunity to discuss on this topic on this webinar. I am very thankful to Dr. Venkatesh, Dr. Abul Hassan sir, Dr. M. Charan for just giving me a time, and I am very sorry to extend the day around 2 to 3 days more due to my resident schedule here at AIIMS Bhopal. The thing is that the same question has been asked by whenever the counseling happens, whether in NEET or in INI. We receive numerous phone calls from all the residents, from all the NEETPG aspirants in the country, to whether to take this branch or not to take this branch. So when normally what happens that whenever you take any branch, be it any branch, every branch is called as the hectic. काम हर जगह रहेगा. But the thing is that if you want a chill life, if you want a fixed duty hours, fixed night duty hours, no emergency, no calls, then you can definitely go for this branch. This is an emerging branch like radiotherapy, like the nuclear medicine, like the transfer medicine. And most important is that this branch is not a saturation branch. Every other branch has become saturation branch because even if you do the MD, MBBS, any other fellowship, but you won't get a job. And finding a job in such scenario is very, very difficult by any of the aspirants after the degree. So being not a saturating branch, it will make you have many opportunity in India and also in foreign countries. So there are some foreign countries which function better than the blood transfusion service in India. But yes, if you are done a MBBS MD from India, definitely you can take this branch as a career branch, because in this branch there are very specific things which are to be taken, which are to be studied in the curriculum, and vast exposure of practicals. If we have proper machines, proper equipments, proper patient load, definitely you can go for this branch.
Okay, sir. Thank you. That inspires more. And the second question is, what is the scope of this field in our country?
See, the scope depends whether you are doing your job in a private sector or in a government sector. In a private sector nowadays, specifically in a corporate sector, it's very much high rising job opportunities. Because in the government sector there are lots of equipments, lots of patient load. In a private sector there are lots of equipments, a lot of patient load, so you will get more exposure. And specifically this branch deals with the immunohematology, stem cell, bone marrow and all. So it will be very helpful because the more you get the patient load, the more you get the exposure, and the more you become master for that things. So yes, in a corporate sector, in a private sector, it is very important. It's very high rising branch, where if you come in the government sector, definitely this branch is very much means it should be overrated, because there are some things which in such matters government finds more than the private sectors, because in such matters obviously the government side is more important. And if you get a government job, it's a safe line for the lifetime. And the thing is that abhi ke liye to ye branch mein kafi we are receiving much regarding the vacancies, because अभी तक इतने ट्रांसफर मेडिसिन स्पेशलिस्ट अभी तक इंडिया में है नहीं. सो जब तक ट्रांसफर मेडिसिन स्पेशलिस्ट का एक रूलियम मेंटेन हो जाएगा, उसके बाद इट विल बी हैविंग अ रश like any other branch. So yes, if you go in a private after MD, you have two options. You can go in a academic line in a government sector, be it central or state, and you can join a private hospital also.
Okay, so thank you. So our next question is it an end branch or is there any further fellowship or DM there?
See, there are many, there are 2 to 3 regarding the fellowships in this branch, namely immunohematology, apheresis are the 2 fellowships which are, and many center institutes like AIIMS Jodhpur, AIIMS Rishikesh, IIMS New Delhi, these all give the PDCC courses. That is also called as regarding the fellowship courses in apheresis section. In stem cell also, some state in the south also gives the main course in the apheresis stem cell also. Some gives in the blood component and therapy. So yes, these are the fellowship courses after MD, and but it needs a 1 year of experience. Directly you won't enter in this. If you want to go for the fellowship, you need to have 1 year of experience after your MD. Then you are eligible for any fellowship course in India. Mostly till now, only in the government, only in the central institutes, there are some fellowship courses. And whereas the DM is concerned, currently we are not in the DM part, because DM hematology is still in a very controversial mode whether to give or not to give. So it will take time, but definitely one day it will become. It can come in one day, but for now there is only MBBS, MD, and fellowship.
Okay, sir. So what should be done post MD, sir, for this?
See, after post MD, you have mostly many of the students go for the SRship. In SRship, what happens that if you are taking, if you are doing the 1 year of experience in SRship in any central institute or in any state government colleges, then you are eligible for an AP. But if you want to become an AP in a central institute, then you need to have a 3 years of experience. After SRship is maximum of 3 years. You should go for SRship for 3 years, because after 3 years you will be getting a opportunity like anything. From anything to anywhere, you will be getting an opportunity, because wherever the vacancy comes out, it will demand 3 years of experience post MD. So yes, you should go for SRship. But yes, the second factor is that many of us also get an offer from the private sector, from the corporate sector. I myself have got several offers from the private sector, corporate sectors in last 1 month after my result and after my tenure completed. So there are much offers. But yes, at that time, if you join a private sector or a corporate sector, at that time you will be having a post of the regarding means no, it won't be counted as an SR. It won't be counted as an experience. You are just doing a job over there like a junior consultant. So that won't be counted whenever you will join for for an AP. For an AP, there should be like 3 years of experience in central and 1 year in state. So many of us have joined after doing 1 year of SRship in central or in state. They joined as an AP. Many of my seniors are doing 3 years of SRship, and then they are having a plan of joining in Central Institute only.
Okay, sir. So if that's the scope, and then what is the scope for job after post MD?
See, post MD means if you have a 3 years of experience, you can go for an AP. See, it depends. If you want to go for a private sector, then there will be no academics. There will be no PG teaching schedule. You will be just doing the job over there and just coming back. But yes, if you want to go for a academic life, a conference life, regarding the PG, the teaching education and all, then yes, after the post MD, 3 years of experience of as an SR, you can join as an AP in any colleges, be it in central, be it in state, you can join. So there are many vacancies which are out, which comes out after 3 months, 4 months, every year. So that you can apply at that time if you want to apply for an AP ship in any central government or state government. But private sector option is always open, because if you're having a 3 years of experience, then anyone there is a high chance that anyone can take you in any sectors.
Okay, sir. So is it a research oriented branch or not, like PSM research oriented branch? Or
see, research depends on the person. If you have interest in any section, just like if I talk about my branch, so my branch deals with the immunohematology, blood banking, apheresis, stem cell, bone marrow. So if you have a interest that I should do means if I am doing a plasma action of around 100 patients, there will be some or the other factors that might be new for me, which aren't in a book or which I haven't studied in my literature. So yes, that becomes a research. Even when we do a thesis part, that is also a research. So it all depends on a person. But yes, if you are a research oriented doctor or is a research oriented resident doctor, then definitely there is a high scope in research, like in a Central Institute of regarding the PG IMA Chandigarh. In that there are many research papers, many research that are done on a daily basis, because there are huge patient load. Huge matlab ki in a single day, the people over there does 10 apheresis. Apheresis includes stem cell, bone marrow, platelet pheresis, plasma pheresis, 10 to 12 per day. So you can count in a 1 month, there will be around 900 to 1000. So so 900 to 1000 is a very huge sample size if you want to go for a research. So yes, it depends on a person. If you don't want to do research, no issue. But if you want to do research, there is nothing there is nothing that can stop you, because you will get loads of patient load, you will get loads of exposures, especially in a central institute. You will get loads of exposure in a immunohematological, like last year we ended up in a Bombay blood group, autoimmune hemolytic anemia. And Bombay blood group is a factor that means we have very much highly trained technicians in our AIIMS Bhopal, but still उन्होंने कभी देखा नहीं था बॉम्बे ब्लड ग्रुप इन देयर 12 years of experience. सो एक वो भी रहता है कि अब बॉम्बे ब्लड ग्रुप आपने से बुक में पढ़ा, आपने देखा सामने से बस. अब इफ यू वांट टू पब्लिश अ पेपर यू कैन गो फॉर रिसर्च, इफ यू डोंट वांट टू पब्लिश अ पेपर यू कैन जस्ट कीप इट, साइन इट एंड जस्ट वेरीफाई द पेपर, दैट्स इट. सो इट टोटली डिपेंड्स ऑन द पर्सन अराउंड योर सराउंडिंग्स. एनवायरमेंट फैकल्टी पे डिपेंड करता है, आप रेसिडेंट्स पे डिपेंड करता है कि अगर अगर उनको इंटरेस्ट है देन यू कैन गो फॉर रिसर्च, नो डाउट.
Thank you, sir. Thank you. And the next question is, what is transfusion medicine in whole about? Like full journey. कितना है आप अगर
See, actually, this is a actually this question is very important question because whenever I receive a call, especially during the counseling session, मतलब कि mostly I receive a call in the third round counseling or in the open round counseling, and not only me, many of my juniors have received a call. एंड उसमें होता कैसा है कि ट्रांसफ्यूजन मेडिसिन एक ऐसा ब्रांच है जिसको बहुत एम्स में लिखते हैं ट्रांसफ्यूजन मेडिसिन एंड ब्लड बैंक. ठीक है, सो ब्लड बैंक इज नॉट अ डिपार्टमेंट, ट्रांसफ्यूजन मेडिसिन इज अ डिपार्टमेंट. लाइक ऑब्स गायनी एंड लेबर रूम तो लिखते नहीं है ना, इट्स ऑब्स गायनी. लेबर रूम इज अ पार्ट ऑफ ऑब्स गायनी, जस्ट ओटी इज अ पार्ट ऑफ सर्जरी एंड एनेस्थेसिया. So blood bank is a part of transfusion medicine. Transfusion medicine as a whole, it includes the counseling, it includes the donor, it includes the TTI screening, the blood banking, immunohematology, stem cell apheresis means something to take apart. If it is plasma, then plasma apheresis. If it's platelet, then platelet apheresis. If it's stem cell, then hematopoietic stem cell apheresis. जो blood component आपको separate करना है उसका आगे आप apheresis लगा दीजिए तो वो apheresis हो जाता है. तो all these things are done by a transfusion medicine specialist. And mostly पहले क्या था कि पहले this branch comes under the patho, but after some years this branch has been separated from patho, and so only transfusion medicine deals with the transfusion part. Transfusion part includes anything, be it a hospital transfusion, be it a ward transfusion, any critical care patient, any regarding the इमरजेंसी ट्रायल्स प्रोटोकॉल, वो सब चीज जो रहता है वो सब कुछ ट्रांसफ्यूजन के अंडर आता है. मतलब इफ राइट ए डोनर एंटर्स फॉर द डोनेशन से लेके जब तक उनका ब्लड इश्यू होता है वो पूरा ट्रांसफ्यूजन. इश्यू होने के बाद जो पेशेंट को जाता है उसका ट्रांसफ्यूजन. कोई इफ वी मतलब हियर एट एम्स भोपाल वी रिसीव मल्टीपल रिक्वेस्ट ऑफ स्टेम सेल, मल्टीपल रिक्वेस्ट ऑफ प्लाज्मा एक्सचेंज, प्लेटलेट फेरेसिस. तो जितना ज्यादा एक्सपोजर होगा उतना ज्यादा आपका मतलब यू विल बी वेरी स्ट्रांग इन दैट फील्ड. And some of the, like I told previously, like in AIIMS Rishikesh, in AIIMS Jodhpur, there is a separate fellowship course for apheresis. In apheresis, you can do any sort of apheresis, depends on your request. So more higher the exposure, higher you will be very strong in that field. Like in the PGI Chandigarh, as per my knowledge, I can be wrong, but to the best of my knowledge, PGI Chandigarh receives highest number of apheresis part, highest number of stem cell, plasma exchange, anything you say, सबसे ज्यादा वहां पे होता है. So इट इंक्लूड्स वहां पर तो एफरेसिस चालू करने का टाइम भी नहीं मिलता क्योंकि इतना पर एफरेसिस प्रोसीजर होता है पर डे. सो देयर विल बी वेरी डिफिकल्ट. सो यस, अगर अभी नीट एग्जाम होने वाला है, अभी आईएनआई होगा, वो तो हर 6 मंथ्स पे होता है. तो जिनको भी चाहिए, आई ऑलवेज सजेस्ट टू गो थ्रू दिस वीडियो वंस, बिकॉज एक ही लाइन में फिर एक ही लाइन में सबको बोलते रहता हूँ एंड उसके बाद फिर आई रिसीव ए कॉल फ्रॉम एनी अदर रिलेटिव, from their friends, their colleagues, their senior junior कि क्या होता है. So yes, you can take this branch, no doubt, but I can assure you this thing that within 10 to 15 years this will be a top branch of India, because like nuclear medicine, like radiotherapy, that is also called the radiation oncology, transfusion medicine, these are the branches जिसमें कोई भी टाइप का saturation नहीं है. मैं ऐसा नहीं है कि बहुत लोग हैं तो फिर आपको जॉब नहीं मिल पाएगा, ऐसा नहीं है. दिस इज ए इमर्जिंग ब्रांच, जितना इमर्जिंग ब्रांच है उतना ज्यादा स्कोप रहता है टू बी सक्सेसफुल इन दिस ब्रांच. सो यस, if you want a chill life कि हाँ मुझे ड्यूटी करना है फिक्स आवर्स, आफ्टर ड्यूटी आई शुड नॉट रिसीव एनी टाइप ऑफ फोन कॉल्स, इमरजेंसी कॉल्स, देन यू कैन डेफिनेटली. यस, नाइट ड्यूटी होता है, एवरीथिंग नाइट ड्यूटी भी होता है, ऑन कॉल भी होता है, बट इट लिमिट्स. ऐसा नहीं है कि आपको रूम पे जाने के बाद फिर आपको कॉल आ जाएगा, ऐसा नहीं होता है. इट लिमिट्स. यू कैन गिव अ टाइम टू योर फैमिली टाइम, टू योर पर्सनल लाइफ, you can definitely give a time. So yes, you can take this branch if you want and if you have interest in a research part.
Okay. So some your good experience from this field in these years, the memorable ones.
See, the good experience. See, what when I was preparing for a NEETPG, I had done MBBS from 13 batch at Ahmednagar, Maharashtra. So after doing that MBBS, and I was preparing at Pune. Okay. So when I had done my, when I was preparing, I was expected to take a good branch like medicine, surgery, and all. But to my interest, though I belong to a doctor's family, Many of my family relatives, including my parents, are doctor. So they told me to go for an emerging branch, because emerging branch में कैसा रहता है कि वहां पर आपका स्कोप ज्यादा रहेगा. ठीक है, तो आई सर्च अबाउट दिस ब्रांच, ट्रांसफ्यूजन मेडिसिन ब्रांच एज ए होल. आई हैड ए टॉक टू सम ऑफ द ऑफिशियल्स apart in AIIMS, in state government colleges, and they told me that yes, you can go for a branch. And इसमें कैसा रहता है कि at that time there were many person who was against कि क्यों ले रहे हो, पता नहीं है कुछ क्या होगा कैसा होगा, बहुत लोग थे ऐसा, नो डाउट. बट स्टिल आई वाज टेलिंग दैट इफ आई एम टेकिंग दैट, तो कुछ तो सोच के रहा, मतलब कि मैं ले रहा रहूंगा. एंड अभी कैसा रहता है ना, अभी सबका देखा देखी रहता है. मेरे फ्रेंड ले रहे पीडियाट्रिक्स तो मुझे भी पीडियाट्रिक्स करना है, मेरे फ्रेंड पैथो ले रहे हैं तो मुझे भी पैथो करना है. इट्स लाइक that only girls take patho micro and boys take ortho medicine surgery. तो ऐसा होता नहीं है. It all depends on your interest कि क्या करना है, कैसा करना है. But yes, the branch was like you can get a personal time, you can get a family time, you can get a time where you can relax yourself. A fix there will be duty hours, there will be emergency hours, on call hours. उसके बाद आपको तो परेशानी नहीं होगा. And second thing that I am a research oriented person. So whenever I go on a duty, see, just one more thing, that a transfusion medicine department has a very sections, like a blood donor area, like a TTI area, like a component area, where the main components are separated, like plasma, platelet, and all. Then it comes a TTI area where all the donor samples are screened for some infections. And then comes a blood bank area where the sample comes, like whenever as an intern, whenever you will send a sample to the blood bank, you will send to the blood bank. Okay, that's a area in the department. Outside the department it will be a apheresis area, मतलब कि जहां से आपको कॉल आता है, like for a GPS patient you might receive a call for the plasma exchange. तो वहां पे you can go, you will have to go there, whether in a ward, mostly ICU cases रहते हैं, critical cases रहेंगे, so you can go there and you can do the procedure. The most the part that I remember, that when I was a UG student, I had just read some stem cell transplant in Harrison book, 18th edition. I had read stem cell transplant, and I found it to be very interesting कि कैसा होता है, क्या होता है, stem cell कैसे निकालेंगे. I thought stem cell is like a blood, कुछ से कोई कहीं ना कहीं से निकलेगा. But when I did in September last year, September, I guess 7 or 8 September last year, I did stem cell procedure personally on my own hands. At that time, I was very happy that that was a case of regarding the multiple myeloma, along with OSA, along with hyperkalemia. बहुत सारे उसमें he was a very critical patient, but very high willpower. He was like, sir आपको जो करना है करो, बस I am ready for anything, but just save me. तो फिर we have got a permission. We have also got a permission from the hematology. We have done this procedure in the hematology private ward because the patient belongs to the cancer department, regarding the multiple myeloma. तो फिर हम लोगों ने फिर वहां पर प्रोसीजर किया था. that was a part जहां पे I feel like yes, something is different what we have listened, what we are doing in a normal day activities. क्योंकि स्टेम सेल आपके पास डेली, मतलब इन एम्स भोपाल स्टेम सेल का लोड कम रहता है जितना बाकी प्रोसीजर्स का लोड रहता है. सो स्टेम सेल जब आपके पास आएगा तो यू विल बी फीलिंग वेरी हैप्पी कि चलो ठीक है, कुछ तो अलग कर रहे हैं एंड जिससे कुछ फायदा हो रहा है पेशेंट को. मींस आफ्टर स्टेम सेल you will give a new life to your patient. मींस जो चीज उनको दिक्कत है उस चीज को आप निकाल के you are totally just giving a new stem cell. So it will give a new life. So yes, there are many memories, no doubt, because I have just completed my tenure. So there are very memories in my life related to here of 3 years of experience. So yes, if you want to enjoy life, family life, a personal life, and academic life, research life, definitely you can go for this branch, no doubt.
Okay, sir. Okay. So what are the preference of college to be taken while counseling in NEETPG and INI?
See, in INI, the preference, it depends overall. Like जैसे कि एम जोधपुर में ज्यादा, एम जोधपुर, एम्स ऋषिकेश is nowadays receiving many much request for the stem cell plasma exchange. ठीक है, देखो blood bank जो part of the blood bank you can get anywhere, but the part of the transfusion medicine department you will get at very less places. Just like AIIMS Bhopal, Jodhpur, Rishikesh, these are the places, even at AIIMS Delhi, these are the places where you can get a many diverse exposure of this branch. And yes, if you want to go for, you can opt for AIIMS Delhi, AIIMS Jodhpur, AIIMS Rishikesh, AIIMS Bhopal. These you can opt because these are the AIIMS जिसको settle हुए हुए 10-12 साल हो चुके हैं. AIIMS तो बहुत पहले का 1960 का AIIMS Delhi है. So yes, you can get a lot of exposure, a lot of cases. So yes, if you want to go for INI, you can go for AIIMS Delhi, AIIMS Rishikesh, AIIMS Bhopal, AIIMS Jodhpur. It will be helpful. And देखो, डिग्री लेना अलग रहता है, सीखना अलग रहता है. If you want to learn something, you can go for AIIMS. If you want कि हाँ डिग्री भी मिले, एंजॉय भी करे, तो उसके लिए भी फिर काफी अलग अलग कॉलेजेस है. But yes, these four AIIMS are, it should remain a priority list because बाकी जगह ब्लड बैंक है. ब्लड बैंक में आपको रिक्वेस्ट आएगा नो डाउट, बट जो एक्सपोजर होता है, जो आपसे बुक में पढ़ते हो एंड एक आप खुद करते हो, तो वो दो एक्सपोजर आपको 4-5 AIIMS में बहुत अच्छे से मिलेगा. स्पेशली इन द जिपमर पीजीआई चंडीगढ़, वहां पर अलग डिपार्टमेंट है, अलग बिल्डिंग है पूरा. स्पेशली एट जिपमर, आई हैव वेंट फॉर ए कॉन्फ्रेंस एट जिपमर. वहां पे एक अलग बिल्डिंग है पूरा. सो वहां का अलग लेवल का अंडरस्टैंडिंग है, अलग लेवल का एक्सपोजर से. एंड जिपमर ऑल्सो कंसिस्ट सेवरल स्टेट्स एट वन. Same in the PJ Chandigarh. In the PJ Chandigarh, the patients come from Jammu Kashmir, from Haryana, from Punjab, from Uttarakhand. हर जगह से पेशेंट वहीं पे आएंगे, तो वहाँ पर एक्सपोजर आपको ज्यादा मिलेगा. So you can go for PJ Chandigarh, then JIPMER, then AIIMS Delhi, then Jodhpur, Bhopal, AIIMS. ऐसा you can go as a priority. In NEET, you can go for KMC Manipal, for Ahmedabad BJ Medical College, जामनगर. ये सब जगह काफी मतलब कि ऐसा जगह है जहाँ पे काफी एक्सपोजर्स होता है. दिल्ली के कॉलेजेस में काफी एक्सपोजर्स होते हैं, सफदरगंज में, आरएमएल में काफी एक्सपोजर्स होते हैं. सो यू कैन ऑप्ट फॉर दिस ब्रांच. हर स्टेट में ट्रांसफर मेडिसिन इतना डेवलप नहीं है. कहीं कहीं डेवलप बहुत अच्छे से है, कहीं कहीं जो कि गवर्नमेंट कॉलेज है, इट विल टेक टाइम to for the equipments, for the regarding the machineries and all. So yes, every branch, every place is good, but it depends on the exposure.
Okay, so one last question from my side कि कोई एक ऐसा चीज, anything that you see it as a disadvantage of this particular field, because everything has an advantage and a disadvantage. So what is the thing that you see as a disadvantage here?
See, the main you don't have a directly patient interaction. अगर if you want कि मैं OPD में जाके बैठूं, I should see a patient, I should write a prescription and then go, ये आपको ये ब्रांच में नहीं मिलेगा. Never. Yeah, there are some hospitals like in Tata. I have just listened. I have never seen that in Tata there are hemoglobinopathy clinics, hemophilia clinics, sickle cell clinics. ये देखा है मैंने. वो अगर हो तो बहुत अच्छी बात है. बट नॉर्मली जो जितना आई हैव सीन एंड आई हैव हर्ड, यू वॉन्ट गेट ए पेशेंट इंटरेक्शन कि आपका एक ओपीडी चैम्बर रहेगा, एसी वाला टेबल रहेगा, चेयर रहेगा, एंड यू विल बी सीइंग द पेशेंट लाइक ए जनरल मेडिसिन रेसिडेंट डू, लाइक ए जनरल सर्जरी रेसिडेंट डू. वो आपको नहीं मिलेगा. पेशेंट इंटरेक्शन यहाँ पे देयर इज अ बैरियर between a patient and you, and that barrier is the main department consultant. Suppose if I'm receiving a request from a medicine department, so there will be a medicine JR in between me and patient, a medicine consultant in between me and that patient JR. So yes, आपका if you are thinking that you find that you need a patient, बहुत लोगों को ऐसा रहता है कि मुझे पेशेंट देखना है डेली. सो उस चीज के लिए ट्रांसफर मेडिसिन नहीं है. उस चीज के लिए यू कैन रिप्लेस ट्रांसफ्यूजन इट ए वर्ड ऑफ जनरल मेडिसिन, तो ही आपको मिल पाएगा. जब ट्रांसफर मेडिसिन में यू वॉन्ट गेट, बट यस जितना पेशेंट से दूर रहोगे उतना अच्छा रहेगा, क्योंकि देयर आर मेनी फैक्टर्स दैट आर इन्वॉल्व. So yes, if you here in our branch, you will be receiving a request for the procedure. You need to go to the patient, see the patient, and confirm whether to do the procedure. Mostly we do the procedure. So yes, there will be no patient interaction. It will be via. After going on the bed, you will be directly talking to patient in the ward, in the ICU. But yes, OPD जो setup नहीं रहता है, ward setup नहीं रहता है, कहीं कहीं अभी चालू हो चुका है. That's why I'm saying in 10 to 15 years it will emerge like the radio has emerged. It will be emerging branch, but abhi ke liye there is no OPD setup. So this is the major factor that will be an hindrance for maximum NEETPG aspirants.
Okay, sir. So thank you so much, sir, for the excellent session. With that, I come to an end with my set of questions, and hope the knowledge gained from this webinar will be of immense help to our juniors doctors, especially for those who always wondered how to choose a unique field out of cardiology and surgery. And thanks a lot for your time and despite your hectic duties. So meanwhile, I'd like to invite you all to our upcoming IMA JDN events, and you can find the registration links for these events in IMA JDN Facebook, Insta pages, and WhatsApp groups. So with that, I'd like to thank once again Dr. Rishiraj sir for his time, Dr. Abul Hassan sir for giving us the support, and Dr. Venkatesh sir, Dr. Manikandan sir, Dr. Arun Kumar sir, and all the IMA JDN members and all the participants of today's webinar. Thanks a lot, everyone, and we are closing now. Thank you.
Thank you. Thank you.